This medical doctor turned startup founder is building AI that provides real-time translation in hospitals so patients and doctors can talk seamlessly across languages.
My mom got really sick, and at the time we had to literally wait for over 15 minutes in the ER in front of the physician, not knowing how to communicate with the physician. My mom was apparently obviously in pain.
This is Cathleen Kuo, a licensed medical doctor building a health tech startup that received backing from Y Combinator.
So being a founder, regardless of how successful you are, you will always doubt yourself, whether you can actually be better or whether your company is actually surviving.
Cathleen recently joined us on the Vesting Show to talk about her goal of fixing the language barriers within hospitals leveraging AI.
We're an AI medical interpreter to help any healthcare provider communicate with patients who don't speak English. It's a real-time speech-to-speech interpreter.
I'm your host, Bryson, and this is Vesting. You're the first MD to come on the stream. Now I can ask doctor questions I've always had thoughts on, because we don't oftentimes get MDs who decide I want to go further with the max pain and go from the difficulty of medical school to the difficulty of building a founder. So, of being a founder. So you are a completely different breed of person in general.
I will say yes, it's very, very rare, but I have always been I have a very type A personality. If I'm not being a founder, I want to do neurosurgery the whole time. And if people know medicine, they know neurosurgery is one of the most competitive field, and you need a lot of rigorous training to get to being actually attending. So it's a totally different challenge, but I love the challenge being a founder and a challenge being a neurosurgeon. And I think the quality and also the characteristic in me really help. I want to be a neurosurgeon, really help me being a good founder as well.
Kind of getting a sense of what made you want to just jump into the healthcare field. If you could just give us the quick elevator pitch on who is Cathleen Kuo, and I hope I said that correctly. If I didn't, feel free to yell at me. But yeah, we want to know more about you.
I have always loved medicine since I was a kid. I always know I want to do medicine. I actually don't know. Never thought I would be a founder one day. I always know I want to be a doctor. I love helping people. I love treating patients, be able to help patients at their most vulnerable time in life. Even since the start of medical school, I never thought I want to be a founder at all. Until when I was third year of medical school, I actually encountered a group of very talented, incredible doctors that they're doing some innovation using AI in healthcare. So really opened my perspective to join the business world at the time. And I actually have the idea that I'm working on right now, because I'm an immigrant myself. Both my parents actually don't speak English at all. You can tell I have an accent, and English is not my first language.
It's still great though. Your accent, you do a great job speaking English.
Everyone can probably tell if you don't speak English, it's actually very hard to try to communicate your thoughts. And when you're actually in pain or at the worst as being a patient, you don't know how to communicate with your doctors. That's a huge problem. And I actually saw this firsthand through my parents, especially when we first moved here from Taiwan. My mom got really sick, and they are in the ER at one of the biggest national hospital in the United States. And at the time, we had to literally wait for over 15 minutes in the ER in front of the physician, not knowing how to communicate with the physician. My mom was apparently obviously in pain. And when the interpreter finally joined us on a phone call, the interpreter literally mistranslated so many critical information. Even the most simple, for example, my mom said that she had pain in the belly, and the interpreter will translate it as pain in the leg. That the doctor prescribed the wrong medication, and then my mom got very serious complication because due to the wrong diagnosis and wrong prescription. And even me and my sister were sent to do a very rare and interesting genetic test called Lynch syndrome, which is very scary if anyone had that in medical field. And so at the time, this is where the idea kind of start building. This is something that need to be resolved, need to be solved, because we're in 2020, we're in centuries already.
Yeah.
This is like a very, very old school, still using human to bridge the language gap, but there's not enough certified medical interpreter to actually be able to help those patients out. Throughout my medical training, saw the exact same issue, and from the provider physician standpoint, like seeing really how language barrier impact healthcare, really
Yeah.
make patients who don't speak English have much worse outcome compared to patients who speak English, which is such an unfair
It's
thing.
disgusting,
It's exactly.
So I'm guessing, correct me if I'm wrong, you speak, is your mother and you speak Mandarin, or?
Yeah. We speak Mandarin, and we still speak Mandarin at home. Both my
Yeah.
parents still don't speak any English at all.
Good for them for sticking with it and like not just conforming. I actually love that. But you touched on something with this being like such a major pain point, and in hospitals, like currently right now, if like let's say I came here from, my fiance, she's Nigerian. If she spoke, a traditional Nigerian language and she did not speak any English, like what would her experience be like if she walked into the ER right now and something crazy was happening and she had to try to wait for the right interpreter?
So the current solution to bridge the language barrier is human interpreters. And usually the hospital or any healthcare organization will source out to a third-party vendor who provide the remote interpreters. And it's usually done over the phone calls or video conferencing, but majority of the time it's through the phone calls. So it's the main issue is that usually the provider have to wait for over 15 to 30 minutes or even
That's so
hours
long.
and have an interpreter not even join the conversation. Can you imagine this if you have like a pain in the ED,
Yeah.
urgently need to let the physician know what's going on? You aren't able to even communicate with any healthcare providers. And it's also very expensive for healthcare organization. Hospital can spend up to millions, even over $5 million every year just on interpretation, because this is
That's
actually
insane.
something mandatory by law to provide for any patient who don't speak English. And yeah, the solution is pretty terrible. That's what I'll say. And there's so many like inconsistent quality of the interpreter as well.
So you feel the pain point. You felt it when you were younger with your mom. You've seen it firsthand in the ER, in hospitals, and you come up with Opalite. If you had to just give me the high level of like how Opalite solves this, like how does it get solved?
Yeah, so we're an AI medical interpreter to help any healthcare provider communicate with patients who don't speak English. It's a real-time speech-to-speech interpreter that will go in back and forth to help. For example, if the doctor speak in English, it translates to patient's language, and when the
Wow.
patient speak, it translates back to patients, to the English for doctors.
So is this like a hardware device that a doctor is wearing, or is it like a software that would be on like kind of like, the nurse computer as it's like going around? Like, how does it work?
Yeah, it's a software, so it can be used on any device. Pretty much every device under the earth. Sometimes I joke to people that
Yeah.
you can even use the Samsung's refrigerator. It will work. So yeah, it's pretty much like a device you can use on phones, tablets, both Android and iOS, and also laptop, computer. We also have a telephonic solution that can be used as on the phone line, also a telehealth solution as well.
That is really incredible. So when you think of, because for me, right, like when I look at startups and I think about like product market fit or startup founder fit, even though this has probably been an issue for some time, I haven't heard of many folks beyond you trying to do something like this. Why hasn't there been anyone who's tried to take on this challenge up until now?
Yeah, great question. So one of the biggest point is technology or AI just got good enough to be able to do very highly context aware, almost real time speech to speech interpretation.
Yeah.
So I'm not technical, so I wasn't able to I won't really be able to provide any like technical standpoint, but it's mostly for example, Google Translate is using something called like neural network, but
Mhm.
right now all the AI translation is using something called transformer, which is much better and highly context aware and very speedy. And also the speech latency, we are able to get it down to over to less than 300 milliseconds compared to
Wow.
previously it takes like probably like 2 to 3 seconds, which is not okay for
Yeah.
healthcare use.
It's so funny because I love books on space, and I was recently
Mhm.
reading this book. I go into ChatGPT and it's like late,
Mhm.
and I'm like, hey, ChatGPT, recommend me a book that has something to do with
Mhm.
sci-fi and space. And it recommends
Mhm.
me this really good book that I've read through, and now I'm like reading the second book. And in the book, you have all of these different space creatures, and they all have their own races. And
Mhm.
they have this thing, like a couple of the creatures, they don't actually speak, native languages. It's like very muffled. They
Mhm.
have these, in a sense, voice boxes that do the similar
Mhm.
translation of what you guys at Opalite do, which is like, I speak in English. If I was in
Mhm.
France right now and I needed medical
Mhm.
care, I wouldn't have to go through an interpreter for English to French. In the same way, someone over
Right.
here, you could kind of do this in any hospital and solve any
Right.
need around the world.
Mhm. Exactly. You can pretty much travel to, let's say, Indonesia, and then using our app and be able to communicate with the providers, like healthcare, any healthcare providers over there as well. We do think this will help opens a lot of, for example, like medical tourism too,
Yeah.
for people going. I know, like for just an example, recently encountered people want to go to Korea to do plastic surgery. Right now, you
Yeah.
can speak with any plastic surgeon in Korea.
Yeah. It's such a, it's like one of those ideas where I'm sitting here almost like, why wasn't this done before? But it makes like complete sense. I don't know if you've used Whisper Flow, but I kind of got the same feeling when I was like using it. It's
Mhm.
like text to speech or speech to
Right.
text for your, for your keyboard, your mouse, and
Mhm.
they also have an app. But when you think about kind of some of the challenges, you guys have a really good idea. You're trying to get into Y Combinator. Was that originally like the plan to go the YC route, or what was the initial thought process there?
So we actually didn't plan to apply at all.
Yeah.
But one of our advisor, also angel investor, who's an ex-YC founder, kind of like push us a week beforehand.
Hmm.
And I literally submit the finished application like pretty much a day before, and then
Yeah.
switch like how we're like putting together the idea, like how we frame the idea, like literally 3 hours before I submit the application, like within an hour of the deadline. So we
Yeah.
totally didn't expect that we're going to get an interview and also get accepted by YC.
What was that process like going through that interview? I guess like you submitted and then you get a message and they're like, hey, like, we want to chat with you. What was that like?
It's pretty surreal because first of all, we are not expected anything, so we didn't really like it's such a cool surprise for us.
Yeah.
And we actually was invited to do the in-person interview at YC office.
That's awesome.
It was very nerve-wracking, but we do think we know what we're doing very well since we've been on this for over a year already by the
Hmm.
time. And we clearly know like what's the problem we're solving, what's our solution, and the partner that interviewed us was pretty much didn't ask any like hard question
Yeah.
and nothing like really challenging. Pretty much just like try to explain what we're doing and how we are thinking about like the go-to-market sales end.
And
And
Grant, I don't want you to share all of the sauce, but
Mhm.
what is like, what does a sales cycle for selling medical software to a hospital look like? I'm guessing it's not an easy process.
Yes, I will say healthcare is probably one of the worst industry to sell into. It has an extremely long sales cycle, and also there's a lot of regulation, multiple like massive amount of decision maker, a lot of loops to run through. So it's definitely not a fun industry to sell into. But for us, our experience actually is not too bad. We are
Mhm.
able, on average, we close all our contract on an average of 3 weeks compared
That's
to like the long
impressive.
sales cycle that other people do, which is usually like months to years. We think one of the biggest advantage for us is the solution we're providing really solve a pain point, because the stakeholder really feel the pain and they want to like cut the costs, want to have better integration into EHR, make the workflow better for healthcare providers. And also I think another advantage of us is my background as both a physician and
Yeah.
also an immigrant. So they feel like they're not buying. They don't want to actually healthcare executive don't want to buy from someone who's software engineer. Don't want to buy from two technologists.
Yes.
They want to buy from someone who has a background, who experienced the problem themselves, and know that we're actually doing this because we want to make healthcare better, rather than just want to do a business.
What is your like early reaction to the experience of being in YC and moving at such a fast pace?
Honestly, I love YCs because both me and my co-founder are very, very hardworking person. Before joining YC, we work a lot compared to most of people. We work at least like 10 hours a day. But
Yeah.
just being YC, we start working around 8 or 9 a.m. and then work until 10 or 11 p.m. like every single day. And we both really enjoy the experience being able to just head down building, really want to like chase a goal. And also actually really really cool. I think a story I can probably share
Please
on
share,
here.
please.
One of the cool things, actually one of the best thing I have ever experienced from being a YC founder so far is right before Christmas, I was actually in Dogpatch trying to like do the apartment hunt, and I was going to show my mom, my sister about YC office. So I walked into YC office, and so PG was there.
Oh,
So I
that's
went
cool.
up, say hi to him, introduce myself, briefly explain what we're building, and he was like, "Oh my god, I love what you guys are building," and let's just do a spontaneous office hour. I was able to talk to him without preparing anything for
Yeah.
over an hour, and that's probably the best hour of my life, learning so much from all the knowledge he had.
That's
Yeah,
so
this is
dope.
like, it's crazy that being a YC founder, you got to experience so many different things, and you got to meet people who's not just someone you watch on YouTube or read through their essays, but actually meet them in person.
Would you rather be a doctor for 10 years and make millions of dollars, or be a startup founder for 5 years, exit, but you have the most stressful time of your life?
Definitely the startup founders, because being a doctor, I can only impact the people that I treat in my life, my own patient. But being a startup founder, the impact I can make is probably to millions of people, like what we're doing right now, and even across the world if we can be successful.
Yeah, you can help.
Selling to others.
You can help so many more people. What do you think are the biggest differentiators between going through going through medical school, right? And going through the max pain of medical school to become a doctor versus the max pain of working on something to become a founder and go through the whole slog of building a company that can change the world? Like, you have the duality of both there. And when you think about it from a pain perspective, what do you think is more painful, and how are you navigating both spaces?
I would say the pain aspect is very different. So being as a doctor, the pain is of a more of physical pain. It's because of the hours that you have to spend in the hospitals or treating the patient. But the knowledge is something you learn already, and you will get better and better. So it's easier mentally compared to being a founder. Because founders, you never know what's going to be you're going to wake up to the next day. There's going to be likely going to be like new set of challenges you have to solve. There might be something that doesn't go well with the business, or the world sometimes just have different things coming out. I literally talked to a founder the other day, another YC founder. They were originally doing something very similar to OpenAI Health.
Yeah.
Like basically, patient be able to upload their records and then ask about the questions. And then literally when they were going to launch the next day, OpenAI released OpenAI Health, and the cloud also released Cloud Health too. So
Oh my
yeah, you
gosh.
never know what's going on the next day, especially with this like fast changing world. every like company trying to come into even like a very a very like niche, highly regulated industry like healthcare.
Mhm.
So being a founder, regardless of how successful you are, you will always like doubt yourself whether you can actually be better or whether how great whether your company is actually surviving.
Mm. You never feel
Mhm.
like what you're doing is good enough, even if someone else is trying to encourage you, right? Like your family could be like, "Oh, Kathleen, like you're doing great. Like, keep pushing. You got into YC, you did all these things." And because the goalpost there's like no stopping of the goalpost. There's always another thing you could be hitting, another metric. So you never really, unless you just take time, you never really get to sit and be like, "Wow, I've made it."
Mhm. Exactly. You never feel like you're doing great. You always feel like everything is a crashing. You're like a loser as a founder. But which is personally, I think that's a good thing because it helped
Mm.
push me forward and it make me work harder.
What do you want to see from yourself and your company over the next couple of years?
Me and my co-founder want to bring our company IPO. That's a goal for us. Um, we would love to really be able to do something that move the needle of healthcare because a lot of the healthcare company I have seen or talked to,
Mm-hmm.
they're not really solving the real challenge. And then what they're doing doesn't really push healthcare forward. But I personally really want to make sure that we're using AI for goods and AI
Mm.
actually can change something for both the providers and patient.
How do we democratize voice for every patient and every doctor in every room?
For example, if someone like you have a patient who's depressed, they went into like going to see a doctor,
Yeah.
pretty much just have Opalite on the like a film of Opalite turn on, and then we can tell the doctor, hey, please screen this patient for depression. This patient likely have depression, or we can do this
Mm.
for like other mental health illnesses, neurological diseases, or even hypertension or diabetes. Can you imagine without getting your HbA1c checked through a blood test, but just use voice to diagnose? I do think this
That's
is a
incredible.
cool direction, and this is the future of healthcare.
You guys have hit some incredible early stage milestones, you know, building a cool product, closing customers, getting into Y Combinator. If you had to give advice to a founder that is looking to do something revolutionary in healthcare and they're thinking, I have this very cushy job, I don't know if I should leave, I'm on the fence. What advice would you give them to help them make a decision on whether or not to just take the plunge?
You only live once. That's what I tell myself. You only live once. You only have this because you only have this chance as a you're everyone has only one chance in their almost like one chance in their life to decide whether they can actually do something for themselves.
Yeah.
And at the time, when I was deciding between being a founder versus a physician, I told myself, this is the only time that I can do this decision. If,
Mm.
for example, I'm 5 years older, I might have a family, I won't be able to work like a founder anymore. I will just do a normal 9 to 5 physician job. So I would say really just think of try to also another just more in general advice is really have conviction.
Yeah.
That's really really important.
A lot of founders pivot because they don't have a deep level of conviction to be able to see around when people are naysayers or tell them you should do this or change that. Do you think that that could be a byproduct of not having enough lived experiences? Whereas, like, you've gone through the rigors of becoming a doctor and being so close to the pain point that there isn't anyone who isn't in the medical field that could probably give you better advice than what you've already experienced on building the thing you're building.
I do agree with you. Like for the strong conviction we have, it's I will say 80% because of my personal experience, 20% from the customer feedback. So it's almost like a combination, but I would say it's definitely a byproduct of personal experience that give us really this strong conviction of what we're doing. And also, I would say mission is another really important things. Really
Hmm.
think about for any founders, really think about what make you angry at night, what make you like wake up every day, motivate you to keep building, keep going. That's really important.